Hi, I am Dr. Balakrishnan. I am an orthopedic surgeon. My hospital name is Sri Balamurugan Ortho Center. It is in Krishnamalayam Road, Kargalpalayam, Erode, Tamil Nadu. My hospital, high-tech orthopedic specialty hospital. Here I am doing all orthopedic surgeries and all replacement surgeries. I usually, my hospital is having 25-bed hospital, so we are more concentrating about RTA, road traffic accidents. So we are having highly equipped ICU and fully equipped 2 operation theatres here. Other than we are doing sports injuries and spine surgeries and replacement surgeries. In replacement surgeries, we are using imported implants for knee and hip replacements. So patients may walk in knee replacement cases. Patient may walk within 4 days normally. He can walk 4 days normally. And hip also, we are doing total hip replacements. Here in my hospital, I am doing hip and knee replacement surgeries. Then we are concentrating RTA cases, road traffic accidents. Now in Erode, I am doing pelvis and acetabulum surgeries. This bone is called pelvis. This socket is called acetabulum. So in the acetabulum and pelvis can get injured, massive accident only. These surgeries and approaches and reductions, everything is a little bit difficult. But past 5 years, I am doing this pelvis and acetabulum surgeries in Erode. This acetabulum and pelvis surgeries, very difficult surgery. The patient may get injured due to massive accident. Why this is very difficult, This is this pelvis containing all vital structures. Here is the bladder, and here is the important vessels, internal and external iliac vessels and nerves, everything. So we are going underneath the vessel and vital structures. So this is a little bit difficult surgeries, but I have done for the past 5 years more than 60 cases in Erode. In my hospital, we did the surgeries by we are having the all insurance schemes like a government free insurance scheme and pension scheme and Star Health and private all insurance scheme we are having. Patients got benefited by these insurance schemes in my hospital. This patient Balni Ammal, age 50 years old. She got injured due to road traffic accident. See the X-ray, the patient had an anterior column fracture. I have done before X-ray. After that, I have reduction. I have done the surgery. Now the patient is all right. Now she is walking. Then one more case. That patient is 36 years old. Weight is actually 106 kg weight actually. Bilateral anterior column, superior MS, inferior MS, and fracture of the patient. Actually, this is a case fracture due to massive accident, lorry run over. The patient, I got done this patient bilaterally, anterior column fixation within 3.5 hours. Patient now is all right. He is walking now. Thank you.